Without further ado, I want to invite up to the stage the Governor of the State of Washington, Governor Jay Inslee.
Thank you.
Thank you.
Thank you. Thank you very much. Thank you so much. I really am excited to be here. This is such an important subject in such an important place. I'm kind of an inlander myself, spent 2 decades in the Yakima Valley. My good friend served on a board of a hospital there and got some flavor of the challenges that we have in healthcare. And obviously we have the single most important subject that we can discuss, which is healthcare. I mean, you think about it, it's a cliche, but it is true. Without your health, you've got very little except your loved ones. And I was thinking this morning about a friend I was talking to this morning who had a young mother of 2 who several years ago developed pulmonary hypotension, a potentially fatal disease. She was otherwise in tremendous vigorous health, and all of a sudden this health crisis hit her. And because we have had innovation, and because she had good health insurance, and because we had brilliant medical practitioners, she was able to have a double lung transplant several years ago. And this weekend now is going to her kids' soccer tournaments. And that's the kind of thing that if we focus on good health care, we expect all citizens to have access to. And I'm here to say that we can accomplish that. And the theme of my presentation is we ought to focus on our sense of confidence and optimism in innovation to be able to improve the health of Washingtonians. And I believe in all 3 of those things: confidence, optimism, and innovation in healthcare as well as our other endeavors. And I want to share with you why I'm here today full of confidence and optimism. And I want to talk about what has given me the sense that Washington can continue to lead the country in healthcare innovation. Fundamentally, it's because in the last 4 years since I've been governor, I've been able to see what our state is able to accomplish when we put our minds to it and work together. And I want to talk about some of those things. You know, we have done some really, really big things together, even in a divided legislature while I've been governor. I want to talk about those things. First, look what we've been able to do in job creation. You know, just last week, they listed Washington as the #1 small business job creation experience in the last several years in the United States. Business Insider magazine looked around the entire nation. You know the one economy they said has the best economy in the entire United States? It's the state of Washington. And Spokane County was just listed one of the top 20 small job creating counties in the United States. We are moving the needle on economic development. That's because we're doing some smart things and smart investments in the state of Washington. This ought to give us confidence moving forward. Look what we've been able to do in education. Now, I first got involved in this business because education is what motivated me to get into public life when I was raising 3 kids in the sagebrush in Yakima Valley. I just came from Lincoln Heights Elementary School, where I saw some of the mentoring programs that are helping beginning teachers really up their game in teaching. And now I'm so proud that the work that I've led to have better mentoring for young teachers is kicking in. Look what we've been able to accomplish in the last 4 years in education. Number 1, we have made the largest new investment, additional investment in education since 1889, the first year of statehood. We have put $5.5 billion of new investment in our kids because we believe in education. That's the largest new investment in the history of the state of Washington, and we're getting money, we're getting value for that. I believe in value, not just investment. Look at the value we've got. One of the largest increase in early child education in the history of the state of Washington. I just saw these 3- and 4-year-old kids get early child education. A little kid with a speech problem, that kid's getting speech pathology training now because of the early child education. That's exciting to me, see that we're giving 7,000 more kids that early child education. It's exciting to me to be governor, to tell you I'm the first governor of the state of Washington is being able to say, we're going to give full day kindergarten to every single kid in the state of Washington. I'm pretty happy about that. I'm happy that we're reducing our class sizes. That is a long overdue improvement, starting with the early grades. I'm happy that we're finally giving hard-working teachers a small pay increase so we can keep good people in the education field. And we had a great bipartisan success this year that allowed me to say this: I'm the only governor in the entire United States who can say we have reduced tuition for every single college student in the United States. We have improved the education of our children at every single rung of the educational ladder. And that's something that we ought to realize is hard, but when we work together, we can make significant improvement. You bet I'm confident and optimistic. I'm confident and optimistic when you look what we've done on transportation. Look, for several years, transportation improvements were blocked in the legislature, but I was diligent. I was willing to compromise. I urged people to work together, and guess what has been produced? The largest advance in transportation in the history of the state of Washington, which is going to help transportation all across the state, starting right here in Spokane County with North-South Freeway and Snoqualmie Pass, and finishing the 520 Bridge, and Pierce County finishing 167. We are moving the needle in transportation. So you look at these accomplishments that we have been able to do as a people in the state of Washington in the last 4 years in job creation, in education, and in transportation. This ought to give us confidence that we can continue the work that we are doing in healthcare. And what we are doing in healthcare is really big time. Let's start with healthcare reform, what we've been able to do. Now, I was involved in this and helping this pass in Congress, so I've been at this for a long time. We want every single Washingtonian to not defer going to a doctor and look at a lump. We want every Washingtonian to be able to take care of their blood pressure. And we have done more to make sure that is possible for Washingtonians in the history of the state of Washington. Look what we have accomplished. 750,000 people have insurance now that did not have access to insurance 4 years ago. We have cut the uninsured rate in half. There's a lot of things we can do for our neighbors, but giving them the ability, in fact, to go see the physician rather than to go into the ER room too late, to go in early, to me is one of the best things we can do for our neighbors. And we are doing it big time, and we're proud of this rollout. And if you go around the country and they ask, who's had some of the most successful rollout of this? They'll tell you Washington State. And the reason is because we did such tremendous outreach, and thank you in this room for participating in that. Everybody in this room did something to make this a success. And I hope you feel some pride in individually what you did to make this success. And by the way, it's not just a personal health care success, it is an economic success. You know, you wonder why we are the #1 economy in the country. It's because we've done some smart things. Look, the fact that we have given people access to insurance has conservatively created 65,000 jobs for people in the state of Washington. When people have better health care, first, obviously, they can go to work because they're healthier, but we also have created jobs in the healthcare industry, conservatively 65,000 jobs in the healthcare industry. So we are moving the needle both on health, and we are moving the needle economically, and we're moving the needle on the value system that we hold dear, which we want our neighbors to be healthy. And we ought to be proud of this success. Now, it isn't just the healthcare reform rollout that we have participated in. We have worked diligently to have entirely new ways of providing integrated, value-based delivery of healthcare in our state. And I got to tell you, I'm proud of the leadership of the people in this room, and including the state government, who are leading the nation in the development of integrated delivery models that are based on value rather than volume. I've known this for a long time. I've worked on this for a long time, and now I'm glad to see it coming to fruition. First, let's talk about integrated delivery systems. Now, we know with a certainty that when we integrate physical and mental health, we get better outcomes. There is absolutely no question about this. Look, we have an opioid problem right now, and there's nothing better we can do about that than having integrated delivery models that integrate multiple systems to access and give people options to deal with this. We know that people with mental illness have a significantly lesser lifespan because that shades over into their physical system. So integrating these systems, we know to a certainty, is going to give us better healthcare results. And we are leading on this effort. Southwest Washington, we know, has developed this integrated model, and now we have won this $65 million federal grant to help us create and allow your innovative spirit to kick in to develop the models that, in fact, will develop that innovation so that we can have a fully integrated system. And again, we are leading the country on this. You go around the country and ask who has really advanced the ball on integration, they'll tell you the state of Washington. Now, that's not just because you have a governor committed to it and some legislators. It's because of the people in this room are helping develop this. And my hats are off to you to understand why, in fact, that is significantly important. Now, that grant and other things are also obviously allowing us to embrace a value-driven payment system. And this is important. We are interested in health rather than procedures. And we now have to design systems so we, in fact, can get value rather than volume. And we, in fact, are doing that. We're doing that in the state government because we are, in fact, we have negotiated some good agreements with our state employees to first incentivize good personal behavior to improve their individual health and try to have agreements that will, in fact, deliver value. And we hope some of the lessons that we are learning in state government can be transferable to the private sector. So our brilliant companies and the state government can work in concert to, in fact, make sure that we get value for our investments. And I can tell you so far from the state experience, it has been very positive. Look what we've been able to achieve. 2% inflation rate. 2% inflation rate. Now this is astounding given the national inflation rate that has existed for the last 2 decades to achieve a 2% inflation rate. And that has happened because of our multiple pronged strategy to deal with behavioral issues, to get value instead of volume, and do smart things with the multiple institutions that are involved in healthcare. And we ought to be proud of that. That translates to millions and millions of dollars saved for taxpayers, for businesses, for consumers across the system. So bending the cost curve down, we are bending it big time in the state of Washington. And when we bend the cost curve down, it's kind of a term of art of us who are in this room, have been working on this for decades. But you know what it translates to? More take-home pay for people. So it doesn't go into the healthcare premium. It can go in their take-home pay. So that is kind of a fancy term of art, but it means to me that people are going to have more money to go out to dinner and maybe have a vacation rather than to go in a healthcare premium. And this is a huge improvement that we have been able to fashion because of the innovation that we have experienced. And again, the state is not the only player in this. I'm so happy that we've been able to work with multiple players, some are represented in this room, to be able to develop the tools to allow this to happen. Now, we know one of the most effective tools is this transparency of data collection on pricing. And you know that we had to have a very hard effort in the legislature, which has succeeded to a significant degree, so that we can get the data we need so that purchasers have transparency in data. When we have that, that allows mechanisms to develop so in fact we can get get value in our purchasing decisions, and so that we let some competitive market forces start to enter into this realm so we can drive down the cost or keep inflation low. And that was a hard fought effort because it took a lot of compromise, it took a lot of cajoling. It wasn't exactly a perfect bill. We might have a little more work to do on it. But again, we're leading the nation in the ability to use data in an innovative way to, in fact, improve healthcare outcomes and reduce the cost of healthcare. And again, we ought to be proud of those accomplishments. So we have done a lot together, and we have much more to do. And I'm looking forward to our conversation, DJ, about some questions you may have about that. Now, I do want to talk about some things I guess was raised. You had a previous speaker here a couple hours ago to talk about these issues, and I want to address a couple things he brought up. I will tell you, when you run for governor, or any public office for that matter, you learn an interesting thing. Anybody can run for governor, and anybody can say anything they want, even if it's totally uninformed, totally oblivious to reality, and sort of clueless about what's really going on. You still get to run for governor. And I defend that situation in our state. But I do think that it is important to talk about the reality of some of the efforts that we've been involved in. Now, I'm told that one of your previous speakers made some sort of mean-spirited comments about Dorothy Teeter and the work that her leadership has been doing to accomplish the things we've talked about. 750,000 new people insured, one of the lowest medical inflation rates in the state, innovative new ways of producing value rather than volume, leading the country and integrating the mental and physical health. One would think those are pretty significant things that are on the plus side of the ledger. But one of the things I guess I heard somebody said that he said was that it's Dorothy's fault that the pharmaceutical industry at EpiPen sort of has jacked up their prices 500%. I don't think that's Dorothy's problem. We, in fact, have been hit by unprecedented, some 100, 200, 300% increases in pharmaceuticals. And that's hitting everybody in the United States, in every state, and has hit the state of Washington. And has been made worse because the party that this other fellow is running for office belongs to has blocked us every time we've tried to do something about that. So no, I think that that's kind of an uninformed criticism of Dorothy. And if both parties, instead of only one party, will buckle down and try to work together to do something about this, we might be able to actually do something about further decreasing the rate of medical inflation. Now, unfortunately, this is not the only kind of uninformed statement. Yesterday, my opponent was talking to the Washington cities, and they asked him what he was going to do about the document recording fee, which is the thing that we fund about half or more of our homelessness programs on. He said he didn't know what they were talking about. He'd never heard of the document recording fee, which is the way we fund our homelessness programs. You really got to do your homework, it seems to me, if you're running for governor. Our Western state situation, you know what everybody in this room knows what our situation is in mental health. The fact is that before I was governor, our state gutted the mental health care system. And I think there's a number of you who've experienced that firsthand. It was a very unfortunate situation. The state effectively cut about 150 jobs, 150 beds where these people who desperately needed mental health treatment in a hospital setting, state cut it, 150 people. And so since the day I've been governor, we've been building that capacity back up. And we've built it up about 120, and we're continuing to build that capacity up in multiple institutions. We have restored some of the work that's been done at Eastern here in this county. We have restored several hundred staffing levels because over 300 staffing levels were cut. And as a result of our efforts, we have reduced the waiting time for people who are waiting to get into Western State Hospital fairly dramatically, as much as 75%. So we are rebuilding our mental health capacity to fill the gutting that took place before I was governor. And this is very important. It's important because these people deserve good mental health care treatment. These are our neighbors. These are our neighbors' sons and daughters. This is personal with me because I've worked with some of these people who are in these hospitals. I worked as a young lawyer in Oregon State Hospital, and I got to work with people with severe schizophrenia and depression. And I know the darkness and I know the pain that these people have. They deserve great treatment. And the reason is because when they get great treatment, you know what can happen with many, many of these folks? They get back to their families. They get back to work. These are people who have positive futures if we give them what they deserve, and that's why I'm so committed to helping improve our mental health care system. And here's some of the other things we're doing, and I hope you'll help on this. One of the things we're doing is to try to build additional community-based healthcare delivery systems in mental health, so that these folks have a place to go after they're discharged from Eastern or Western Hospital. And this is very important, because these are folks who need transitional housing. They need wraparound social services as they transition back to a life they may have had at one time. And this is desperately needed, because right now there's about 100 people at Western State Hospital who are ready to discharge. We have rehabilitated them, but they don't have a place to go. So we are working to rebuild the community support systems so that they have a place to go, and we can increase the number of people so we can get into Western State and reduce further the wait times that we are experiencing that should be reduced to acceptable levels by the end of this year on the forensic side, and at least the average on the civil side by the end of this year. So we're making progress, but we got more work to do. And it is a noble goal for us to do. And if we use the same innovative talents that we have had to be so successful already in so many realms, we're going to do really, really great work. So I want to thank you for your efforts. I want to tell you that I was confident in our ability to help our state improve when I ran for office. I'm more confident now, and I'm going to look forward to DJ's softball questions in our discussion. Thank you.
Thank you for being here. I know you got a lot of places to be. It's a big state and particularly busy time of year. Let me ask first about integration that you brought up. You mentioned maybe having a little more work to do there. I think on the one hand, as you mentioned, that's among the most innovative things happening, I think, in Washington State healthcare, particularly Medicaid, is the physical and behavioral health integration. Southwest Washington showing a lot of good early results. Chelan and Douglas in North Central Washington have expressed an interest to move forward. But there's some skepticism and hesitancy in some other counties in the state. And I think one concern is that if we wait for all counties to move in 2020, that it'll be a real burden on the healthcare authority to move the whole state in one fell swoop. Any observations or thoughts or considerations about figuring out a staged approach where maybe we move some regions a little earlier, offering incentives through the waiver or through other mechanisms where we might move more expeditiously rather than wait till 2020?
Yeah, I think that should be on the table. I think that when we do have, what you might call early adopters, that we ought to give them an opportunity to move forward. Now, I'm very hopeful, too, that this waiver request that is now in is going to give both us flexibility, help multiple counties, but is going to increase the confidence that if they move forward, help is going to actually be there. So it's my belief that when we succeed on this waiver, and I hope we will, that's going to increase the willingness of local communities to move forward and the ability. And this is extremely important. Listen, it's not just for kind of the health insurance aspect of this. It's for the mental health aspect of this. I talked about the need to help people have access to leave Western State Hospital. Look, having an integrated model, this waiver will allow us to have access to resources to help them not just with counselors or psychiatrists, but also housing and transitional housing. Yeah. So this answer of integration is important more than just bending the cost curve down or satisfying our need for innovation. It is fundamental to our existing support network. So yes, I think we ought to consider that.
You also mentioned, of course, some criticism in some quarters about the healthcare authority and particularly in the Senate Ways and Means Committee last year during the legislative session about a $200 million overrun, driven in significant part by pharmaceutical costs being higher. How do we mitigate against some of those surprises in Medicaid moving forward? And maybe specifically related to pharma costs and getting those under control, but as the state takes on a little more of the share moving forward of Medicaid on expansion, and as integration is deeper, how do we try to get a little more clear-sighted view of the cost of Medicaid?
Well, first off, let me just address the first part of your question. Their assertion there was an overrun is just flat wrong. That is just flat wrong.
Now, there's a lot of choose your term of art. If you're a cowboy, they have a term of art of what this is. I won't use it. Others do. This was a situation where we as businesses have to make predictions and projections what the costs will be. Every state faced the same situation this year when they made their predictions, which is that the industry surpassed by several 100% in many instances what they were going to charge for their drugs. Now, I don't know really anybody who predicted that, and successfully they did. Who in this room thought they were going to increase the cost of an EpiPen something like 500%? But they did. And Dorothy Teeter is not responsible for that. Nobody in this room is responsible for that. Now, what do we do about that? As I've expressed, I belong to a party that has tried on multiple occasions to have some mechanisms to restrain, in certain circumstances, the rate of these shocking 1 year, 500% cost increases. We think in certain circumstances that has been unreasonable. The party I don't belong to has blocked every one of those efforts, both on a state and federal level. And the current person who's running against me is against our executive authority to do anything about that through a regulatory approach. I think that's unfortunate because taxpayers are getting stuck with this. I'm not happy about that. I'd rather we have some reasonable rate of pricing that respects the need for innovation, respects the need of this industry to have large investment. It's very expensive to develop a drug. I get that. It can cost $1 billion to develop a drug. And this industry needs to have access to capital to be able to do that innovation. We're doing great. We're curing cancer essentially in the state of Washington. But we've had other circumstances where, hedge fund managers come and buy these companies, corner an old drug that, there's no innovation involved in it, and jack it up 500%. So, we might want to think about voting for people that, A, have a clue about this industry, and 2, are willing to do something about it.
So let me ask you, if you walk down the hall here and you walk into a time machine, and you go back 3.5, 4 years to when you were getting your feet on the ground and inaugurated as governor, what would you tell that Jay Inslee on day one of his first gubernatorial term that they probably didn't know starting his first term that you know now?
Son, you're going to have a great job. You're going to do great work. How's that?
That's a good answer. That's a good answer.
Well, what would I tell that? That's an intriguing question. You should do this for a profession, DJ. That's a really good question. I guess I would say, A, your current confidence is warranted. I mean, seriously. So when I walked into this job and I said, we're going to bend the cost curve down, we're going to insure hundreds of thousands of people, we're going to lead the country in innovation in healthcare, we're going to do significant things in the first 4 years along the road to integration, I would have said, that might be a little too optimistic. That might be a little too grandiose. But we have accomplished those things. And obviously, I'm just one of the players in this drama. But I do think I have helped you in this room in many, many ways accomplish those results. So I guess what I would say to that young man or younger man, shoot high. Yeah. Because big things are possible in an innovative state. And in our state, look, we're the most innovative state in the country. We lead innovation in aerospace. We lead innovation in medical research. The NASA rocket that went up to the asteroid last week, it's going to go to an asteroid and take a little piece of it and bring it home. The rockets, where those rockets were made was Redmond, Washington. They had 20 rockets by Aerojet Company. But we were also the most innovative in a lot of these policy issues that allow us, businesses, to thrive because we can reduce costs and we can increase health. And I think that type of innovation, it's not like Thomas Edison, but it is innovation of an important type. And that innovation requires people who are willing to, take risks and have a vision. And that's what we're doing here in this state. So I'm proud of it, and I hope we can continue it.
One more question, sort of with two sides of the coin, maybe. Let's walk down the hall to the time machine again. And let's jump forward to November 9th.
The other thing I forgot, I'd tell that young man, you're going to look so much older in 4 years, too. That's
Jump forward to November 9th, and it's the morning after the election day, and it's you've celebrated a re-election, and it's rainy out, and it's gray, and it's kind of cold, and you go out and you pick up the paper, and at the top of the paper it says, Trump wins presidency. And you go in, you have a cabinet meeting that first morning with your staff and your agency leadership. What direction do you give in that hypothetical, admittedly a hypothetical situation, but how does the Inslee administration work with, what's the first thing you do to work with the Trump administration?
Well, let me make it clear. I'm opposed to the Trump-Putin ticket. Okay, I want to make that clear right from the get-go. To give you an honest answer to that question, I can't give you any substantive answer to this question because the Republican nominee for president is a totally unguided missile, and you have no idea what direction it's going on any day. Because on Monday he may be for X, and on Tuesday he could be for Y, and Friday deny he ever said anything. So it's difficult on healthcare to consider anything that substantively a response to that, because there is no ideology or substance there that one could predict he would actually try to do. I don't think, if experience to date, it would suggest it would not be positive, though. And I haven't heard anything from him that would be helpful to our efforts in our state to reduce inflation, to increase health. By the way, one thing, can I
Please
mention something I didn't talk about? Look, the thing we ought to be most happy is our Healthiest Washington, our Healthiest Next Generation efforts that we're making to reduce childhood obesity and chronic disease in our people. And I do want to mention this. It is an important initiative. It is gaining results. We're seeing more kids eating nutritional meals. Schools are getting kids to have more physical education. It's the kind of innovation that really bears fruit, because we know that, 20, 30, 50, 60% of all illness is behaviorally involved. And our kids are going to experience an epidemic of diabetes when they're 30 or 35 if we don't do this. That's the kind of thing we're doing in the state of Washington. I just haven't heard Mr. Trump evince any recognition of that at all. So we'll keep innovating here. We'll be undaunted, and we're gonna do our thing.
So last question, but similar. It's election night, and you've won re-election. Hillary Clinton has won election to the presidency. You have a long-standing relationship with the Clintons, including some tough votes in Congress in that first term of yours. And President-elect Clinton calls you to congratulate you. What is your response? What is your ask? What do you tell her on the phone on election night when she calls?
Thanks, and let's get to work. And it would be that brief. Being president is a tough job, and I do support Hillary Clinton for president. We've worked on many things together. I'm for raising the minimum wage in the state of Washington. I'm for raising the minimum wage in the state of Washington. My opponent is not. He didn't want to have a statewide minimum wage increase statewide. And I challenge anybody to be comfortable living on $9.50 an hour in Spokane County or $10 an hour in Spokane County. We need to raise our minimum wage. And I'm with what I hope will be President Clinton in this regard. I think we should take common sense measures against gun violence. Just common sense measures. I was for closing the gun show loophole. I voted to prohibit assault weapons, There's an issue between myself and my opponent in this regard. I think people ought to have sick leave. A lot of people, particularly women, have to make a decision whether to go to work when they're sick or not be able to feed their kids. We ought to have some small sick leave in this state. I support that. My opponent and Hillary Clinton's, opponent hasn't done anything until the other day, and I don't consider him sincere about doing something about this. So we're going to work. We will be working in parallel on a lot of things, but no matter who's president, I'm going to get up every single day trying to help Washingtonians realize their dreams, and I will remain confident. And I will close by thanking you for your giving me reason to be confident and optimistic, because we have a team of healthcare innovators in our state that are more creative, more dynamic, more successful than perhaps any other state in the United States. And I'm proud to have worked with you, and I am very hopeful I can continue to do that for another 4 years. DJ, thank you for your efforts.
Thank you very much, Governor. I appreciate it. Let's give him a round of applause.